Have you ever submitted a drug registration file in CTD format and been surprised it was delayed or rejected due to a technical issue? Or maybe you've heard about eCTD, but you're still not sure what the actual difference is. More importantly, is switching to eCTD really worth all the effort? In this video, we're going to break down the difference between CTD and eCTD, and how choosing the right format can impact the speed of your product's approval and how smoothly you interact with regulatory authorities. I'm Dylan, the AI assistant here at Cobalt Research. Hello everyone, welcome to Cobalt Research channel. Through the process before, you need to know that choosing the right submission format isn't just a technical detail. It's a strategic decision that can impact your entire file. Many companies do excellent work in research and development, but when the file reaches the regulatory authority, delays happen, not because of scientific content, but because the format is outdated or non-compliant. And no, this isn't just about paper versus digital. The real difference between CTD and eCTD becomes clear when the review starts, when you need to make an update, or when the authority sends back a question. In this video, we'll break down that difference in a clear and simple way and help you choose the format that fits your product and your target market, step by step, in practical language. Let's dive in. So, what is CTD and why was it a big deal? First, you need to know that CTD, the Common Technical Document, is the globally accepted format for drug registration files. It was a breakthrough when it was introduced. Before CTD, every country had its own format, making it extremely hard to prepare one file for multiple markets. CTD brought consistency. It organizes your data into 5 clear modules. Module 1, Administrative and Regional Information. Module 2, Overviews and Summaries. Module 3, Quality Pharmaceutical Documentation. Module 4, Non-Clinical Study Reports. Module 5, Clinical Study Reports. This structure made it easier for reviewers to find what they need. But over time, it became clear that static paper documents, or even simple PDFs, had their limits. Navigation was difficult, updating information was a hassle, and reviewers could miss important inconsistencies simply because the structure didn't support fast cross-referencing. And now, what makes eCTD different and better? This is where eCTD came in, and it changed everything. eCTD is not just a digital version of CTD, it's a fully integrated electronic system that uses XML-based files and a dynamic table of contents. It allows you to submit updates, roll back to previous versions, and respond to regulatory queries almost automatically. For example, instead of resubmitting the full dossier, you can submit a single updated document, and the system will track that change in context. That means the authority can immediately see what was changed, when and why, with zero manual digging. It also keeps an automated lifecycle history, so every update is recorded in sequence. Most major authorities, like the FDA, EMA, Health Canada, SFDA, and MHRA, now require eCTD, and in many regions, submitting in any other format may lead to automatic rejection. Let me break it down with a few real-world comparisons. In CTD, if you want to review a specific section, you have to scroll manually. In eCTD, you click once and land directly in the right place. In CTD, there's no formal way to manage updates or document history. In eCTD, every modification is time-stamped and version-controlled. And here's a big one. Formatting errors in CTD, like missing bookmarks, incorrect numbering, or broken TOCs, could get your file rejected before anyone even reads the science inside. But with eCTD, there are built-in validation tools like Lorenz DocuBridge or eCTD that catch those issues before submission, saving you from technical rejections. So, why this matters for your market access strategy? And why should you care? Because switching to eCTD isn't just about compliance, it drastically reduces your chances of delays due to avoidable formatting or technical issues. If you're targeting fast-moving markets like Europe, the Gulf, Saudi Arabia, Canada, or the US, speed matters, and so does format. In fact, eCTD isn't just preferred anymore. In many cases, it's the only accepted format. Now we have an important question. Is CTD obsolete? Not entirely. Some smaller or emerging markets still accept CTD, but even in those regions, the trend is clear. The future is eCTD. The sooner you adopt it, the faster you'll be able to scale and respond to evolving global requirements. So, how Cobalt Research can help? At Cobalt Research, we don't just help you convert your files to eCTD. We work with your team to review the content of every section, ensure consistency across modules, and eliminate errors that could trigger rejection or major delays. We also use internationally certified eCTD tools to ensure your dossier is 100% compliant before submission. If your goal is to register your product professionally and efficiently, you need to understand the real difference between CTD and eCTD and choose the approach that matches your target market's requirements. Not sure where to start? We're here to guide you, step by step. Thanks for watching, and don't forget to subscribe so you can catch our upcoming videos, packed with insights to make your regulatory journey smoother, faster, and more successful. See you next video.